Welcome back to the Shigeaki Podcast, where we challenge assumptions, uncover quiet risks, and help you protect your health, especially after 60. Today, I want to start with a story I'll never forget. It was a Tuesday morning. A 67-year-old patient of mine, we'll call him Robert, came into the clinic pale and shaken. He'd just returned from a short stay at the hospital, a minor stroke. No lasting damage, but a major scare. What made it worse, he thought he was doing everything right. He exercised, ate clean, didn't smoke. And he told me proudly that he had been taking vitamin E every single night for my heart, he said. Because I read it prevents clots. The problem? He was also on a daily aspirin, and the vitamin E dose he'd been taking was nearly 1,000 IU a night. The combination thinned his blood too much, disrupted clotting, and likely triggered the bleeding in his brain. It was meant to help him live longer, but it nearly ended his life. And that's the quiet danger we're talking about today. Not prescription drugs, not cigarettes, not fast food. But vitamins, the kind you buy over the counter, take without thinking, and assume are harmless. And in many cases they are. But in certain doses, taken the wrong way, or by the wrong person, they can raise your risk of stroke overnight. That's not an exaggeration. That's physiology. And as always, I'm joined by someone whose wisdom guides this podcast from its very name. He's a neurologist, a teacher, a true icon of healthy aging, still writing, still teaching, and still speaking with clarity at over 100 years old. Welcome back, Dr. Shigeaki Hinohara.
Thank you, Dr. Hyman. It is always good to be here. In Japan, we teach that medicine without awareness is not medicine, it is risk. At my age now, over 100, I've seen hundreds of patients who took pills with good intentions, but without understanding how their body would react. And in older adults, the body is less forgiving. After 60, everything changes. The way your blood flows, the way your liver filters, the way your nerves react to excess stimulation. So even a safe vitamin, if taken too late in too high a dose or mixed with other medications, can become dangerous.
Today we're going to talk about that. This episode will cover the vitamins that may quietly raise your risk of stroke or vascular damage after 60, why timing matters, and why overnight can be the worst time to take some of them, the doses, combinations, and red flags you should watch out for, even with so-called natural supplements, and how to use vitamins safely, precisely, and with respect for your aging physiology. Because we're not here to make you afraid of vitamins. We're here to help you use them wisely, or leave them out when they do more harm than good.
The older the body, the more carefully it listens. Every capsule, every drop, every decision leaves a mark. Let's make sure that mark leads toward strength, not toward risk. Let's begin.
Vitamins are often treated like insurance. Take one a day. Take two. More must be better, right? But after 60, your body no longer responds the way it used to. In fact, it becomes more sensitive, not just to medications, but to anything you put in your system. Your liver processes nutrients slower. Your kidneys eliminate excess less efficiently. Your blood vessels become more reactive, and your nervous system is less tolerant of overstimulation. This means that what seems safe in your 40s or 50s can become too much in your 60s or 70s.
Yes, many of my older patients are surprised when I tell them to stop taking certain supplements. They say, "But doctor, it's just vitamin E. It's just B12. I've taken it for years." And I explain, your body has changed, but your routine has not. That's the danger. After 60, the margin for error narrows. The same dose of vitamin B6 that once gave you energy now keeps you awake all night. The vitamin D you started for bone health now causes calcium to build up in your arteries. The heart-healthy vitamin E in the wrong dose now increases your risk of bleeding.
It's not just about the vitamin. It's about the dose, the form, the time of day you take it, and most importantly, what else you're taking alongside it.
In Japan, we use the word mai, which means timing, balance, and space between things. Taking a vitamin is not neutral. It enters your body as a message. And if that message is too loud, too late, or delivered too often, the body stops responding well. Especially the heart, the brain, and the blood vessels, all of which are vulnerable to subtle imbalances after 60.
So before we even get to which vitamins are risky, you need to understand the real danger isn't always the vitamin itself, it's how casually we use it. Because the supplement industry often makes us feel like natural means harmless. But arsenic is natural, so is snake venom. And yes, too much vitamin E, D, B6, or A can act like poison in a body that's no longer in balance.
And often the person taking the risk is the one most vulnerable. Thin, elderly women on blood thinners, men with undiagnosed atherosclerosis, seniors with poor kidney function, or people mixing multiple over-the-counter pills without realizing their interaction. These are the people who suffer silent consequences. Not immediately, but gradually until one day the body can't compensate.
So, in the next part of this episode, we're going to walk through the vitamins most often involved in stroke risk, the specific situations where they become dangerous, and how to use or avoid them wisely, depending on your age, medications, and health goals. Because sometimes the smallest pill can create the biggest ripple if taken without understanding.
And it's never too late to adjust. The body still listens when we speak to it with respect. Let's look at the most important vitamins to re-examine after 60.
Let's talk about specifics. There are 5 vitamins that I've seen cause real problems in patients over 60, not because they're bad, but because they were used without guidance. They are vitamin E, vitamin B6, vitamin B12, vitamin D, vitamin A. Each of these has benefits, but in certain doses, forms, or combinations, especially in aging bodies, they can quietly increase the risk of stroke. Let's begin with vitamin E. Vitamin E is a fat-soluble antioxidant. It's often marketed for heart health, to protect blood vessels, prevent oxidation, and support circulation. But what many people don't realize is that in high doses, it also acts as a blood thinner, and that becomes dangerous, especially when combined with medications like aspirin or warfarin, which already thin the blood. Studies have linked high-dose vitamin E, more than 400 IU per day, to an increased risk of hemorrhagic stroke, particularly in older adults. Now, let me pause here and explain that number. IU stands for International Units. It's a standardized way of measuring fat-soluble vitamins like A, D, and E. For vitamin E, most multivitamins contain around 30 to 100 IU, but some standalone supplements, especially those labeled high potency, can contain 400, 800, even 1,000 IU per capsule. That's 10 to 30 times more than your body may actually need. And if you're already taking a daily aspirin or have fragile blood vessels due to age or high blood pressure, this combination can quietly tip the balance from protection to danger.
I've seen this in practice. A patient thinks more vitamin E means more protection, but instead their blood pressure drops too low at night. They bruise easily. Sometimes their balance changes. A small vessel in the brain may have bled without warning. In Japan, we rarely give vitamin E alone. We prefer to get it from food like sunflower seeds or dark greens, where the dose is gentle and natural.
2. Vitamin B6. Vitamin B6 is essential for nerve health and metabolism, but high doses, especially over 100 milligrams a day, can cause nerve toxicity, insomnia, and interfere with homocysteine metabolism, a key factor in stroke risk.
Yes, and many multivitamins contain more than you need. When B6 is taken without enough folate and B12 to balance it, it may raise homocysteine, a substance that irritates blood vessels and contributes to clot formation, especially dangerous in older people with silent cardiovascular disease.
3. Vitamin B12. B12 is often used to boost energy, especially in seniors, but too much, especially via injections or high-dose pills, can mask deficiencies in folate or worsen outcomes in people with kidney issues. In some studies, high-dose B12 was linked to an increased risk of stroke in elderly diabetic patients, particularly those with poor kidney function.
I've seen this when people self-prescribe B12 because they feel tired. But tiredness isn't always from deficiency. And B12, when overused, can create imbalances, especially when combined with iron or vitamin D overload. It should always be guided by blood tests, not internet advice.
4. Vitamin D. Vitamin D is essential, but it's also overused. Doses above 10,000 IU day over time can cause calcium to build up in blood vessels, leading to stiffness and increasing the risk of heart attack or stroke. And if someone is dehydrated, which is common in seniors, that calcium isn't excreted efficiently.
I always remind my patients vitamin D is a signal to absorb calcium, not to flood your system. If there's not enough magnesium, vitamin K2, or water, it settles where it shouldn't in arteries, not bones. For older people, balance is everything.
5. Vitamin A. High doses of synthetic vitamin A, especially retinol over 10,000 IU, can increase the risk of intracranial pressure and disrupt lipid metabolism. This affects circulation and may raise the risk of small vessel strokes.
In my clinic, I've seen patients with blurred vision, dizziness, and confusion, later traced to excessive vitamin A supplements. We get plenty of provitamin A from carrots, sweet potatoes, and greens. There's no need for synthetic megadoses.
So, to recap, the 5 vitamins to watch carefully after 60 are vitamin E, thins blood too much; vitamin B6, may raise homocysteine; vitamin B12, risky in kidney or metabolic disorders; vitamin D, risk of calcification; if unbalanced, vitamin A, pressure-related and vascular risks. These aren't harmful in themselves. They become harmful when used without personalization.
Vitamins are not candy. They are concentrated messages to the body. After 60, your body speaks softer, so you must listen more closely and act with more precision.
Most people don't think about when they take their vitamins. Morning, afternoon, before bed. What's the difference, right? Well, after 60, timing can mean everything, because your body doesn't process nutrients the same way it did in your 30s or 40s. Your digestion slows, your blood pressure drops more sharply at night, and your heart rate and circulation follow a very predictable rhythm, one that can be disrupted by the wrong compound at the wrong time.
Yes, I've seen many older adults take their full list of vitamins right before sleep, including vitamin E, B complex, and sometimes even iron or calcium. They think it's just supplements, but the body does not see it that way. At night, your system is not preparing to act, it is preparing to repair. Taking stimulatory or blood-altering compounds during this quiet phase can disturb both circulation and sleep architecture, 2 things that protect the brain from stroke.
Let's break this down. At night, your body naturally lowers its blood pressure. This is healthy. It gives your blood vessels a rest. But if you add a blood thinner like high-dose vitamin E right before bed, especially if you're already on aspirin or medication, you might overshoot that drop. The result? Dizziness upon waking, increased risk of small vessel rupture in the brain, silent hemorrhages, especially in people with fragile capillaries.
And that's not all. Vitamins B6 and B12, when taken late, can stimulate the nervous system. Some patients report difficulty falling asleep, vivid dreams, or nighttime anxiety. Others feel fine at first, but over time, poor sleep leads to higher morning blood pressure, insulin resistance, and elevated stroke risk. The danger builds quietly over weeks, not hours.
Here are a few common mistakes I see. Taking a heart health vitamin pack at 9 p.m. with 400 IU vitamin E. Drinking vitamin D drops with dinner, then not hydrating properly. Popping a B complex at bedtime, thinking it will help with energy tomorrow. Using a calcium-magnesium blend with added vitamin A right before lying down. On paper, they sound harmless. But in practice, especially in a 70-year-old with borderline kidney function or mild arrhythmia, it's a setup for nocturnal blood pressure instability, a major trigger for both ischemic and hemorrhagic strokes.
In Japan, we follow a rhythm. Morning is for vitamins that support alertness, B-complex vitamin C. Midday is best for fat-soluble vitamins D, E, A with food and water. Evening is reserved for calming herbs or minerals. Only like magnesium or chamomile. Never high-dose antioxidants or stimulants at night.
Exactly. And if you take multiple supplements, split them, space them. Let your body respond, not get overloaded. If a vitamin disturbs your sleep or makes your heart race, that's not support, that's stress. So, what's the takeaway here? It's not just what you take, it's when you take it. And after 60, your nervous system, blood vessels, and heart need restful nights more than ever. Don't sabotage that by throwing vitamins into your body when it's asking to shut down.
The body repairs at night not just cells, but patterns. If we overload it, then we interrupt not only sleep, but healing. So let's use our knowledge wisely.
So, let's say you're over 60. You're taking a few vitamins. You're not sure what's helping or what might be quietly hurting. What should you do? Let's make this simple, because vitamins can be powerful, but only if they're used with precision. And precision after 60 means watching your dose, your timing, and your combinations. 1. Start with blood work, not marketing. Don't guess what your body needs. Check your vitamin D. B12, folate, homocysteine, magnesium. It's not expensive and it saves you from unnecessary pills.
Yes. At my clinic, I always test first, then prescribe only what's missing. Guesswork is where most overdoses begin.
2. Avoid megadoses, especially of fat-soluble vitamins. Here's a safer range for most older adults. Vitamin D, 800, 2000 IU day unless deficient. Vitamin E under 200 IU day, ideally from food. Vitamin A retinol max, 2500 IU day unless advised. B6 no more than 25 mg day unless treating deficiency. B12, 250, 500 mcg day unless you need injections.
I always remind patients a little every day works better than a lot once in a while. The older the system, the more it prefers moderation.
3. Take vitamins at the right time and with the right meals. B-complex C magnesium, morning, vitamin D, EAK, midday with healthy fats, iron, calcium, only when deficient and never near tea or coffee. Never take stimulating or blood-thinning vitamins late at night.
And don't forget water. Many seniors are slightly dehydrated, making fat-soluble vitamins harder to process. A glass of warm water with vitamins helps your body accept them more gently.
4. Be careful with combinations. Here are some common risky combinations. IC vitamin E plus aspirin warfarin, increased bleeding risk. B6 plus B12 plus folic acid in unbalanced doses. Homocysteine overload. Vitamin D plus calcium plus no. K2, risk of arterial calcification. Iron plus calcium or magnesium, blocks absorption. If your supplement label looks like a paragraph, step back and simplify.
Simplicity is safety, and safety is strength.
5. Watch your body, not just the bottle. The most powerful lab is still your own body. If a vitamin makes you dizzy, anxious, bloated, wired at night, or groggy in the morning, that's not your fault. It's feedback. Listen to it.
I always say the body never lies. It simply waits for you to stop ignoring it. Your job isn't to push through, it's to notice and adjust.
So, here's what we want you to remember. Vitamins are not neutral. After 60, your system changes. The wrong dose at the wrong time can do more harm than good, but the right vitamin in the right form at the right moment can truly support your body's ability to heal.
Health is not built by force. It is built by attention to timing, to simplicity, and to your own response. Take less, observe more, and give your body the space to show you what it still knows how to do.
We live in a time where more people take vitamins than ever before, and yet many feel more anxious, more inflamed, and more exhausted than they should. So, what happened? We started treating vitamins like shortcuts instead of what they truly are. Tools. Tools only work when used correctly, at the right dose, in the right hands, and especially at the right time in life.
After 60, your body still listens, but it listens more slowly, more carefully, and with less tolerance for guesswork. One vitamin too strong, one moment too late. One assumption too casual, that's how risk enters the room quietly.
You've been listening to the Shigeaki Podcast, where aging is met with clarity, not fear. Subscribe if today's message brought you insight. Share this episode with someone you care about, someone who takes vitamins but may not know the full story. Leave us a review to help more seniors age with wisdom, not confusion. Until next time, listen deeper, act slower, and always respect what your body is still trying to teach you.